One of the hardest things about cranial is getting the different anatomic orientations down. So when someone's standing or sitting, right, we know those anatomic orientations. We know what anterior, posterior, superior, and inferior are. We've got those down. However, when you're doing cranial and you're sitting, okay, and you have one set of anatomical orientations and the patient is now supine, and most of the time you're going to be treating them in a vault hold, all right, their anatomical orientation and yours are going to be different. It's imperative that you name all cranial bones and movement after where the patient is, the patient's orientation. If you name them and you think about how the cranial bones are moving from your orientation, you will not pass or understand cranial. So this is vital. Most of the time when you're performing cranial, you are sitting at the head of the patient. So this is your view. You're looking at the top of their head. That is superior. Okay, remember, everything's based off of the patient. This is superior. And going up towards the ceiling is anterior or ventral. Going down towards the ground is posterior or dorsal. Down by the feet is inferior. So when you're doing cranial, when you're palpating or treating, it's usually from a vault position, okay? Right. So the patient is supine. So you have two different orientations going on here. I'm in a seated position and they are supine. So I've got to remember to use their anatomical orientation and not mine when I'm describing what's going on with the cranium, okay? So again, for me, this is anterior, this is posterior, superior, inferior, okay? However, for them, this is anterior, this is posterior, towards me is superior, and towards their feet is inferior. So when I'm describing motions of the bone, I have to do it according to them. Just like when we talked about anatomical positions in cranial, also the axes and the planes can be confusing because the orientation of the patient, because the patient is supine and you are seated, and so the orientations differ. So the transverse axis is going to move from right to left. Okay, that's going to be your transverse axis. And what will happen is around a transverse axis in a sagittal plane, you'll have the cranial bones performing flexion and extension. And I'll show you that plane in a second. Axis, let's look at it from a treatment position. The transverse axis going from left to right or from right to left, so going right through the skull of the patient from left to right or right to left, is going to be the same for the patient as it is for you. As you can clearly see, the transverse axis is the same for you as it is the patient. Vertical axis is going to run from superior to inferior, or the patient, the top of the patient's head, to their feet, or from their feet to the top of the patient's head. That's your vertical axis. So let's see how that's going to look. Here's your vertical axis. Okay. And you can see it's running right towards you. It's running right towards you if you're sitting at the head of the patient. Now, what's going to happen is around a vertical axis in a transverse plane, you're going to have rotation. So the cranial bones will rotate in a vertical axis around a transverse plane. Another vantage point of that vertical axis. Here's your vertical axis, okay? And it's going to go from the feet through the head all the way actually through you, or it can go from the head down to the feet. But you can see how that vertical axis is for the patient. And you can clearly see the difference. You can compare the vertical axis to the patient with reference to the patient compared to the vertical axis compared to you. Okay? Anterior posterior axis. And that axis is going to go from the front of the patient to the back. Okay? And now let's compare that to, the treating physician, or where you're going to be in the vault hold. Comparison between the physician who is treating, which is going to be you, and the patient, and the point of reference for the anterior posterior axis. So the anterior posterior axis is going to go right from the anterior to the posterior part of the patient. And this is going to be completely, as you can see that here, this is going to be completely different than the anterior posterior axis that goes through you. Right? So that reference point is going to be very different. So you want to keep that in mind when you're referencing the anterior posterior axis in cranial. Okay, now let's know planes. So let's make this a sagittal plane. Here we go. And let's put it, remember, orienting this to how we're going to look at the patient from a vault hold. So we're looking superior to inferior. So that's a sagittal plane. That's how it's going to look. Okay. And let's put that on a transverse axis. So here's your transverse axis. All right. So this is flexion and extension. And what the cranial bones are going to do is they're going to move into flexion. There's flexion. And here's extension. Flexion, extension. So now let's look at a transverse or horizontal plane. This is our transverse or horizontal plane. Let's put it up there. It's our transverse or horizontal plane. And we're going to put that right through the patient's cranium. All right. So it's dividing the cranium from upper half and a lower half. And then we have our axis, and our axis is going to be a vertical axis. So the vertical axis is going to go from the top of the patient's head down towards the toes. And the action here is going to be rotation. So the cranium and the cranial bones will rotate in a horizontal or transverse plane around a vertical axis. Now let's talk about a frontal or coronal plane. Remember, the frontal or coronal plane is going to divide the body. In this particular case, it's going to divide the skull, the cranium, into a back half and a front half. Okay? So that is our frontal or coronal plane. And then we're going to use an anterior to posterior, so going from to the front to the back axis. All right? So movement is going to occur in this frontal coronal plane, and moving around this anterior posterior axis is what we call side bending or lateral flexion.